Welcome back to our class on the mind-body connection. That's our topic today. How important are our thoughts in terms of our health? Does our mind control our health? We're going to see in our class today. And that is the mind-body connection. How powerful is that? We are actually what we think we are in many cases. And you're going to see how the mind controls the body. So as you discuss this with your clients, they need to see the connection that the mind and the body, these two components are connected in order to produce good health or poor health. Let's ask this question. Could a positive thought process mean healthier communities? What do you think? We're going to see that today, that the thoughts we have in our mind can stimulate the way we feel. And therefore hope. Can hope actually fight heart disease, chronic migraine, high blood pressure, and even death? Do you think positive? Because hope is a positive emotion. How can positive emotion influence our health? Can being happy prevent hypertension and diabetes? You know, the wise man Solomon said that a merry heart is good medicine, but a broken spirit dries up the bone. A merry heart means a happy heart, and that is actually medicine. It is true that happy people tend to live longer than those who are not. And that is a fact. Scientists have found this out. As a matter of fact, there was a study done in San Francisco on patients who were angry, patients who had negative emotions. This was done for about 18 months, about 6 weeks or so, and we saw that the patients who forgave most, the patients who were happier, had less symptoms of diseases. So researchers are asking the question like this to help improve public health awareness, public health method. How can we use happiness and positive emotion to affect the health of the public, the communities? All right. So would you agree then? Well, you will agree later on that positive emotions could equal to good health. Now, certain physical responses such as blood pressure are considered to be involuntary, but we have a degree of conscious control over our blood pressures as well. For example, when someone gets stressed or anxious, the body, there are neurotransmitters that will dictate certain production of certain chemicals, hormones, adrenaline and epinephrine. When these hormones are released, for example, the epinephrine, that creates vasoconstriction. Vasoconstriction will put more resistance on the blood vessel wall, and this will increase blood pressure. And that is how that your thoughts can control your blood pressure. The same with diabetes, because the body is put in a state of action. So blood pressure goes up, heart rate goes up, blood sugar goes up. If the patient or the person continues to be in a state of stress, then we'll have prolonged high blood pressure, prolonged high blood sugar, and that could lead to these diseases and even heart disease. Mental, emotional, and spiritual well-being are the cornerstone for good health. As a matter of fact, the World Health Organization describes health as not only the absence of physical disease, but a state of emotional and social well-being in order to prevent diseases. So we need the physical well-being, but emotional and social and spiritual well-being are also important for good health. Hippocrates believed that good health was a balance of the mind, the body, and the environment. So in order for us to have good health, we have to have good positive thoughts. We have to be happy. The body physically should be in a good state of health, a good state of balance. And our surroundings, our environment, the people we relate with, her family members, all of that are friends. If we don't have good relationship in all of these three factors, then we will not have good physical health. Because remember that a human being has multiple facets. We have the physical, but we have also the emotional, we have the spiritual, and we have the physical dimension. All of these need to be in a balance for us to have good health. And that is very important. All right, so let's then look at longevity and healthy lifestyle. Scientific breakthrough have directly translated into effective therapy that supports a healthier lifestyle. They have translated this into all of this positive emotion, into using all of this to create healthier communities, healthier lifestyle. Many people think that when you talk about lifestyle, we're discussing only nutrition and exercise. But stress management and positive emotion, these are integral to very, very good health. And we're going to continue to see this as we continue in this lesson. So virtually every major medical center now has some sort of mind-body program integrated into medical treatment. So we're not only treating diseases now with nutrition, with exercise, but also positive emotions. All right? Now we're talking about lifestyle, so we're not discussing medication here. We're discussing healthier lifestyle. So for us to really have good health, we need to have good, healthy emotions. Now, many medical conditions that are as a result of our mind-body connection are often related to our diseases and our symptoms. All right, what are we going to say about that? So as I mentioned before, for example, some patient might come and say, Dr. Cooper, my blood sugar is high today. I've been stressed, I've had financial problem, I have a death in the family. How does that translate into the high blood sugar? And as I mentioned, that we have neurotransmitters in our brains. We have norepinephrine, we have dopamine. When we have dysregulation of our emotions, then we have varying degree of levels of these hormones. For example, dopamine. Dopamine, if the level of dopamine, this is a neurotransmitters that will stimulate the production of various substances. So dopamine level, a high level of dopamine or enough level will decrease the symptoms of depression, such as lack of trust, lack of motivation. Dopamine also will decrease will block norepinephrine and therefore will stimulate vasodilation, lower blood pressure. So our minds are connected to our bodies. That is important. Stress. Many people are stressed. Stress is a huge problem in terms of chronic diseases, hypertension, and different diseases, even pain. When we're stressed, we have the production of negative hormones that can cause inflammation in the muscles, inflammation in the joints. We can have joint pains, we can have muscle fatigue. A negative hormone can even lead to bone loss because we have cortisol. Cortisol will decrease our bone density and bone mass and therefore can lead to osteoporosis. So negative emotions are associated with negative health. All right. Scientists are investigating whether prolonged stress factors can actually take a toll on the immune system, and I'm going to address this. We do know that in order for us to have strong immune system, we need our white blood cells to function well. the white blood cells that are called lymphocytes. These are the cells that will destroy bacteria, destroy viruses. When we are stressed, okay, then we'll have decreased functioning of our white blood cells. If we don't have enough, a great balance with some of these hormones, dopamine, for example, then we'll have a decreased function in the white blood cells, and that can also lower our immune system. So the human mind could increase or decrease immune function, making us susceptible not only to infection, but to other diseases, as I mentioned just now. Stress, as I mentioned, can cause your blood sugar to go up because stress can increase insulin resistance. Stress can also decrease the availability of your insulin and therefore can cause high blood sugar. So these are some of the conditions that are associated with stress or with negative emotions. Obesity. We know that sometimes when patients or people are stressed, they stress eat and then they gain weight because they overconsume calories. Migraine headache because of the muscle tension. Diabetes, as I mentioned. Heart disease as a result of high blood pressure and sustained high sugar. Depression, anxiety, irritable bowel. There's so many diseases and premature death as a result of our negative emotions, the mind connecting to the body, the dysregulation of our neurotransmitters, the dysregulation of our stress hormones can lead to many diseases. A person's thought process could be the difference between his health and his disease. All right, very important. So you are what you think. So we have to help our clients to regulate their emotions. We have to help our clients to realize that healthy emotion, happiness, is important for good health. So look at the word healing versus cure. What is the difference between healing versus cure? Where do you want to take your clients? Do you want to heal them or do you want to cure them? What do you want? That is very important. Fortunately for us, there are things that can help us to think positively. Because as we think positively, we are going to lead our clients to healing over curing, not only the removal of the disease, but the holistic approach to total wellness. So exercise is important. Prayer and meditation have also been proven to decrease somebody's stress level. Let's talk about exercise. When one exercises, he increases the neurotransmitters that are called the happy hormones, the endorphins. Endorphins will then lead to a state of relaxation. Exercise can also lead to vasodilation. Vasodilation will decrease blood pressure. Decreasing the blood pressure will decrease one's risk for heart disease. Scientists have also found that prayer and meditation tend to put that patient in the state of hope, the state of happiness. In doing so, we have positive and good hormones that will have good effect on our physical body. So all these are very important to have good outcomes. So thoughts that focus on positivity can actually create real value in a person's life. And that's why in the Bible it says that we should think good thoughts. Be positive. Don't stress yourself for anything. But in everything we must have faith and trust in our Creator, because there we have the source of happiness and positive thought. So choosing to be happy and hopeful provides a whole body healing to a person and not just the cure. So we have to help our patients or our clients. We have to coach them on how to be happy, because happiness is indeed medicine. So Dr. Sandra Levy discovered that hopefulness and positiveness increases survival in women. But I would add that will increase survival in all of us, whether women or men. All right, so negative emotions, we're going to go through that quickly. Negative emotions like anger and hate and fright and anxiety, this will stimulate the immune system, that's your hormonal system, to produce certain hormones. We discussed them earlier on. Hormones like cortisol, hormones like epinephrine. Okay, these hormones can have negative effect on your body function. Not only that, you'll have decreased white cell function and therefore decrease your immune system. You will also have increased inflammation to the muscles, to the joints. You'll have fatigue, you have pain. You can also have, as we mentioned before, high blood sugar because of the decrease in insulin or insulin resistance. You can also have high blood pressure. All of this will increase the risk for diseases and death. Now, how can we retrain our mind and our thought processes to think more positively and focus on things such as being happy and hopeful? How can you direct your clients then to think positively? That is something you're going to have to sit and work on, knowing that positive thoughts, that's integral to good health. You have to coach them. You have to sometimes meet in groups. Sometimes meeting in groups, group counseling, will help the client to see things differently, to hear what's happening in somebody else's mind, and therefore use those in order for themselves to be happy. So breakthroughs in understanding mind-body connection have translated into effective therapies for many stress-related disorders. So that's very important. The relationship between prayer and health has been a subject of scores of studies over the last several years. Why is it that people that have a faith community, why is it that people that pray more, people that read their Bible, people that have a connection with the divine, why is it that they tend to be healthier? Why is it that they tend to live 7 to 10 years longer? And as I discussed earlier on, that dopamine is a neurotransmitter that is integral in terms of one's thought process. Dopamine is important in regulating our emotions, important in decreasing depression. We have serotonin on the other hand, that is important in our well-being as well, or our happiness, the way we express our emotions. All those hormones are very important. So praying or meditating can do lots of things, not only for your physical health, but spiritual well-being as also, and that's very, very, very important. All right? So as time passes, we will slowly begin to retrain our mind to a more positive thought process, and it will become second nature. If we have to think to be positive, if we think to be happy, then we need to move away from that. That needs to be automatic. So we have to guide our clients to understanding the importance of happiness and how they can maintain a state of happiness for a very long while. 2,000 years ago, people understood the importance of a strong and resilient support group. This is important because many times one might feel lonely. They think they need support. They need others to help. And this is why, as I mentioned earlier on, support groups, seeing the clients sometimes in a group setting is important. But a good community, a good church, good family relationship, that's important for one to be positive, for one to be happy, for one to move to a healthier lifestyle. Our spiritual health is an integral part of being wholly, totally healthy. We cannot be healthy without that spiritual component. There are many people that are looking for something else. They have money, they're able to eat well, to exercise, but something is missing because as I mentioned before, we have that spiritual dimension that must be fed and must stay healthy. It is one thing to cure symptoms, but it is a completely different thing to heal the whole person from the inside out. And that is where we want to get our clients. We want to heal them from the inside out, or else we will not help them to stop eating. We won't help them in terms of preventing the depression. We will motivate them to exercise. We need to get to the root cause. What is eating them in the heart? And how can we fix the negative emotion for them to have good health? Having a spiritual connection to the divine can greatly increase a person's outlook on life. Studies have shown that people who have a faith community, people who go to church more than once a week, people who have a creator being that they think about, they have hope and they tend to live happier and longer life. It can also offer a kind of a healthier lifestyle. True happiness and hope can be brought from this spiritual dimension. We have to lead our clients to that spiritual dimension, the great healer, the creator, and that is where we need to take our clients to for them to experience healing from the inside out. Total care, a holistic approach to healing. I hope you have enjoyed the presentation. You can listen again, write the information down, and remember that we need to take our clients to not to be so dependent on drugs, but help them to understand how to change your lifestyle. Help them to realize that the change begins in the mind. If we cannot change the mind, we cannot change your health. Thank you for watching, and I hope to see you in the next lesson.